So yeah, as I just said, the session's being recorded this morning, so thank you so much for joining us. Today's agenda, so welcome and introductions obviously initially, and then we'll roll into the context and then examples. So I'm Kerry Baines. I work for the personalised care team in Healthy London Partnership, focusing predominantly on work supporting social prescribing. Today's session is kind of another addition to the work that we have been doing in producing information for you to support you with conversations with patients and people that may be feeling concerned or cautious about the vaccine, and knowing that this has been a challenging time, and people just need time as well to be able to make a decision that feels like it's their own choice. So I want to welcome Dr. Jagan John on. Jagan, I did see you pop on, so hopefully you're still with us. And just so we can set a bit of context in terms of what the next phase is around the vaccine programme. So Jagan, are you there?
Hi, can you see me?
We can indeed.
Yeah, hi, thank you for Kerry. Hi, welcome everyone, and thank you for coming to this session that we are doing regarding vaccine cautiousness. The context of where we are, I'm Dr. John, I'm a GP by trade. I'm also the clinical lead for Barking Dagenham and the North East London CCG chair and lead for Healthy London Partnerships and NHS England, the London region, as the clinical lead for personalised care. So what we have really in London is the fact that in the next 4 weeks till July the 19th, we're really trying hard to improve the uptake of the vaccine, getting people back to their normal lives as much as we can, and also really trying to get out to those hard to reach communities to say, look, it's safe. Get the vaccine, it will protect you from getting really, really sick, and also obviously stop you from getting into a really serious way in the hospitals. But the truth is, in London, we are a city, we're a global city, and in some respects we have done really well compared to other global cities. But the uptake in London is still way behind the rest of the country. And it's no surprises, our population is younger. We have multi-generational households where some people have had the vaccine, some haven't. We've also had concerns and queries, particularly in the beginning and still carrying on, regarding the vaccine and some of the concerns that people have. We've had guidance change. You've heard about the vaccines, that certain age groups can't take certain vaccines, or pregnant women can only take, for example, the Pfizer or Moderna vaccine if they're breastfeeding or having children. But generally there's some real concerns, and half of the problem is in London is it's not just about the vaccine, it's actually a wider issue. Issues with their life, issue with their lifestyle, issue with their home circumstances. And in some respects, we are coming to all our residents and saying, look, please take the vaccine. We want to get you protected, but also protect people around you. But it's suddenly become, well, a lot of people that I've been speaking to said, well, no one's really bothered with us before, or I've got actually all these other issues. So the role and the context why we really push really hard across London is for us to really obviously listen, understand their concerns, work with them. There's no mandatory rule, you must have the vaccine, but also try to make sure we're signposting, as it mentioned in this, to say, if you want to get vaccinated, and make it as easy as possible for people who do want to have it. And if they want to have it local, make sure that we're signposting to the right people. The other issues is obviously some people just want a bit more time to consider it, speak to their doctors or speak to people they trust. And in some respects, the fantastic respect that our social prescribing link workers have amongst our population and the other wider personalised care teams within the primary care networks and wider, is that they actually are trusted people, and even as clinicians we trust our link workers to give us real strong feedback of some of the issues that people have. So some of this is to really, make sure that you're fully equipped. Today's session is fully equipped, and learn from people who have done really fantastic work, but also trying to make sure that we collectively are trying to give everyone the right information, the right choices, and also making sure that we reach out and address some of the other issues that that may be impacting on their lives. So I really thank you for all your support. I have a lot to learn from all of you, and I really mean that. Some of the information you're sharing today, obviously I'll be sharing with my colleagues who may be PCN directors and clinical leads, but also the GPs and the wider workforce in general as well. We still have some work to do, as well as getting our residents vaccinated. We still have some of our care workers who still have concerns, and some of our medical teams, although most have been vaccinated, there's still some people who are still not sure. So it's a conversation, it's a dialogue. It isn't about forcing people into decisions they're not happy about, but what it is to make sure that people feel confident and comfortable to have the vaccine as we move forward. Thank you, Kerry. Over back to you. Thank you.
Wonderful. Thank you so much, Jagan. So today's agenda, I kind of went to the first couple of items, and just to let you know what else we're going to have today. So we're going to have a few people share their examples, so social prescribing link workers in different areas across London. There'll be an opportunity for Q&A as well. So that could be, questions about what you've heard, but equally, if you've got any questions for our GP representatives on here today, then that would be great. And also, if you've got any of your own suggestions or, things that you've been doing as well, or any reflections from what you've heard today, we'll be covering that. And then also the different resources and support that's available to you at the moment. So first up, we have the lovely Minion, who is representing Leaside PCN. So if you'd like to pop on board and just share the work that you've been doing in your area.
Yes, absolutely. Thank you. Hi, everyone. So I'm a social prescriber based in Leaside PCN, which is in the Stratford area in East London. So I've been in post since November time, so kind of around the beginning of the vaccination programme. And actually, we were really lucky in my the GP practice I'm based in. We have the kind of main vaccination centre for primary care in Newham, based in the same building that we are based in as a surgery. So that has opened quite a lot of opportunities for myself to be involved in the vaccine service, because it's kind of on our doorstep, which was really useful for us to kind of encourage patients, because it's, kind of easy for them. They know where it is, and they kind of knew a bit more about what was going on. It was on their doorstep almost, so that was really useful. So for myself, in terms of vaccine uptake, I think it was a process of kind of, as Dr. John has already said, it's using that relationship that you have with the patient, using that opportunity to discuss with them how they feel about the vaccine. So I'm not entirely sure whether everyone uses the same system, but we use EMIS, and you get a nice little pop-up in the corner which tells you whether or not a patient has had their vaccine. It also tells you whether they need to book their second appointment, and what kind of group they're in for priority. If they're particularly high risk, it will tell you there. So that's something which I've been utilising quite a lot, just opportunistically at the end of a consultation with a patient, speaking to them, briefly, just saying, and I can see that you haven't had your COVID vaccine, and then just kind of asking for permission to discuss it at that point. And I think because as a social prescriber, you build that relationship with the patient, they trust you, and also you know a bit more about their personal circumstances, so you are able to get a bit of a deeper insight into what barriers they might be facing, and obviously you've also already had that conversation with them where you've understood their life to a bit of a deeper level, so they might feel more comfortable discussing any barriers or concerns with you. So what I tend to do is kind of, you know, speak to them about it, ask them if they're comfortable to discuss it, ask them what, you know, why they haven't had it yet. Sometimes, as Dr. John said earlier, it's just, I want a bit more time. And what I find to be is really useful in that case is, you know, just to kind of say, okay, so lots of people have already been vaccinated, go on the kind of millions of people. What do you think is going to change if you wait? And that sometimes, you know, people say, actually, I'm not really sure whether anything will change. And I guess in this, you identify the barriers, but also maybe a lot of those misconceptions and those individuals who are maybe relying on less reliable sources of information. So, you know, people who say, oh, well, I saw this on Facebook, I saw this on the internet, on YouTube, and using that opportunity to kind of direct them to more reliable sources, and also to other kind of peer support and sorry, my words are getting blurred here, but yeah, directing them to more reliable sources. So in Newham we have the vaccine peer support champions who provide telephone kind of conversation with a peer or another member of the community who can give advice and answer questions and concerns about the vaccine. So this is something which I really tried to signpost people to through my role as well, where if they had questions or concerns and they just wanted to speak to someone a bit more about it, then I would kind of signpost them onto that. But equally, from a more practical point of view, thinking about, you know, if you know that somebody has 2 kids and they're not going to be able to get to the vaccine centre at a certain time, thinking flexibly, knowing about what vaccine services are available in your area and being able to kind of offer them a better alternative if there is a practical barrier in the way, making sure that you work together to solve that. And yeah, so I guess in general, the main thing that I've been trying to do through my role is speaking to the patient and, you know, really taking the time to understand their views, taking the time to think about what barriers they might be facing, and also to kind of point them towards the right advice and the right support in order to get their vaccine. But yeah, as this quote kind of says at the bottom, what I find is really useful is kind of thinking about motivational interviewing as well. So kind of reflecting what they're saying to themselves and asking them to think about their own, you know, their own drives, their own motivation, and their own biases, and getting them to challenge them themselves, because actually a lot of the time they do understand what they need to do. They do know that the vaccine is quite important, but there's often just maybe a little bit of a barrier in the way. And if you ask them to kind of consider that themselves, they normally work it out. It's just having that space and giving them that opportunity to almost, you know, work it out on their own, which I think we are well placed in this position of trust and able to kind of utilise the opportunities that we get as social prescribing link workers.
Absolutely brilliant. I think everything that you shared there is just so rich, so valuable. So thank you. If anyone has any questions for Minion, if you want to just pop them in the chat now, we do have the opportunity for questions after. So yeah, if you've made any notes of the things that she's shared so far, then fantastic. Please do share them or ask them shortly. So thank you, Minion, absolutely brilliant. So heading over to David. So David's in Brent area and focusing on understanding people and their individual circumstances. So David and I met and we had a really great conversation about a particular patient that he supported. So David, if you want to jump on and just share this with everybody. And equally, if you've got anything else as well in terms of little nuggets of advice or approaches that you've taken to share with people, that would be great. So David, if you want to jump on.
Hi everybody. So I'm David. I work in Kilburn. That's part of Brent. I've been there for 18 months. I can definitely see a change in general. There definitely seems to be more people that do want to take the vaccination. But I'm going to talk about a woman, one of my patients that I had about 3 months ago. She's in her 40s. She's from a Caribbean background. The main issue is it's actually not her, it's her son. Her son has a severe learning disability. He's 20, he lives at home, he's non-verbal, and it was quite a complex situation. She'd obviously talked about him getting the vaccine, and she's been my patient for quite a long time. We've done other things from PIP appeals to benefits. We even did PPE at the beginning. So I've got a long-term relation with her because things do turn up. And when this came along, I can honestly say at the beginning, she was definitely quite against taking the vaccine, and even more so for her son. Her son goes to a school for people with learning disabilities. She was obviously concerned. And I think the approach was about, first of all, me just talking about it. And I know from the first few phone calls, there was a lot of, she just didn't want to talk about it. Obviously her peer group, her parents, and everybody around her was saying to her no. And it was definitely a bit of a struggle. I think after we spoke quite a few times, I started telling her that, conveniently enough, at the same time, I was also actually volunteering in a vaccination centre. I told her about some of my experiences, all positive, specifically telling her how that people do come, and how obviously with her son, it would be really good if she did want to come. I think on about the third or fourth phone call, there was definitely a change. I think also she was starting to worry about him going to school, what would he pick up there? And I think that was happening. But I think to me, the secret was just the fact that we talk regularly. We talk every couple of weeks about other things. And in every call, I did bring it in. And I think even she was starting to change her opinion. Obviously, she was very nervous about him going. He hasn't had injections recently. He hasn't had blood tests. So he's a really kind of very difficult person to get vaccinated. And I have to admit that one thing I will say, I was a little bit disappointed that even though everybody knew about him, the surgeon knew about him, everybody knew about him, but there was a kind of a bit of an impression that not everybody was actually that interested in helping him. I did even contact places like MenCap. But in the end, we decided, me and the mother, that she would go to a small pop-up where one of the surgeries that I was working in, I knew that day there was only 20 people invited. I knew that she knew that. She knew it was a small place. She knew the surgery well. I have to admit, I knew the doctors, but I was quite amazed because I did hear from the doctors afterwards and from the mother how such a positive experience they had, because it took them about 45 minutes. But the doctor was amazing. She was just really patient. He really didn't want to have the injection, but after 45 minutes, they gave him the injection. And so I think the combination of myself, obviously keeping her calm, a really good patient GP that was in no rush and she was just amazing. And the fact that I think the mother also really she realized she wanted the vaccine. She also had the vaccine the same day. I just think the whole combination of everyone working together proves that it can be done. But there was a lot of work. I don't think she would have had the vaccination if they hadn't had a social prescriber. I'm not trying to big myself, but I think she really needed the support from beginning, after, and obviously even when it comes to the second vaccination. I think it's a great example of social prescribing, because at the end of the day, that's what we're all about, building up relationships, talking to the people. We got her done. I think also now in hindsight, looking back and even thinking on the fact that she needed the support, and I think with the social prescribing, to me, it's a win-win situation. You've got the situation where you've got a relationship with a person. I'm not a doctor, so I've got much more time. I've got the time to talk to her. my experience as a vaccinator also, not vaccinating, but in a vaccination centre really helped as well. I think obviously the change in obviously the situation, obviously people are more taking it, also helped. But overall, I just think that to me, it's about just working on using these relationships. And I think I'd like to have more people, even doctors, GPs coming to me. I know some do, but I'd like to have more doctors even sending me a message saying this patient could do with a bit of a conversation, because the GPs obviously have got limited time. We've got more time. So I think to me, it's very obvious that we should be more involved. I will say, just towards the end of my piece, the only thing I will say, I do still have some patients that are not taking the vaccine. So I can't say my success is 100%. I don't think I mean, I'm saying on one hand that social prescribing is very important. So I don't think, I think our success rate is really, really good. So I think so, but I do think you have to be realistic that there are patients that are not going to take the vaccine. And as much as I want to say that we are the solution, which we are, we do have to take account there will always be a patient. I know some of my patients that don't want to take the vaccine. So it's something to think about as well. That will always be patients that will come along that, even with all the relationship and all the talking, are not going to take it. And even if myself, the GP, we all try, if they don't want to take it, there is an issue. So it's something to think about as well. What do we do with the people that just don't want to take the vaccine with all the help and support? So, but on the other hand, I still believe that the majority do work well with social prescribers, and the results are there because we do get them to take the vaccine. So that's me.
Absolutely wonderful. Thank you so much, David. And you're just highlighting the power of the relationships that you have with your patients and understanding people, and spending the time with them as well. Even though maybe 2 weeks does feel like a long time, but you really spent time to support this woman and her son, and you made it happen, you made it work. You also got people working together as well. So there's so many great things there, so many positives. So well done, and thank you so much for sharing that. I think it's a really, really great example to share. So hopefully you'll be able to stay on if people do have any questions for you. And equally, if you have anything that you want to share further a little bit later on, then that'll be fab. So thank you, David. Next up, we have Gay Palmer, so from South Southwark PCN, talking about working together to break down misconceptions. So Gay, if you are there, it'd be great to see
Hi, Kerry. Hi, everyone.
Hi.
My name is Gay Palmer. I'm a social prescriber, and I'm based in South Southwark, which is Southeast London. And I started March 2020. It seems so long ago now, but we kind of started right in the heart of the pandemic. We're very fortunate in Southwark that we are very much a part of our primary care network from the very, very beginning. Our clinical directors and everyone has been really keen to have social prescribers, so that's where we've had a great advantage. But in relation to the COVID vaccinations, a lot of our team, we were asked to kind of participate from the very beginning. So we started in wardening, people trained up and can now vaccinate. So we've really kind of been a part. But an aspect of the vaccinations that was really very close to my heart was the hesitancy. So South Southwark has actually got quite a few of the wider determinants of health that are known officially. So, for example, Peckham, which is Southeast London, was noted in the national news for having a very high number of people that weren't taking the vaccination. So there's a high cultural diversity in South Southwark, which does actually include the high Latin American communities. So our approach was slightly different. So we looked at the communities that we're connecting with and said, right, how can we support? One of my GP practices, over 25% of their actual practice residents are actually of the Latin American community. So the GPs were saying to me, Gay, I need the organisations who can help, because a lot of their time it's with interpreters trying to engage with the Latin American community. So we looked at, right, what can we do? How can we connect with our communities to really kind of get the message across and engage and support with people more? So what we did was literally we set up pop-up clinics right across both North and South Southwark. So a lot of it was based in Peckham, again, where there's a high proportion of hesitancy. We made it easy. So instead of always expecting people to come to us, something which is really important is going to where the people are. I shared with a colleague and she said, but no one's hard to reach. no one is actually hard to reach. It's how we try and engage and connect with other people. So we took the service to them, and that was something very important with talking to my clinical director, saying it's not always about them coming to us. If we want to help and support them, we need to show them that we are willing to go to where they are and actually engage with them. The clinics were supported by the GP practice and St John's ambulances as well. So we really had a connection of not just primary care, but looking at the wider community who could also support. What we also did is then we worked with one of our local organisations, the Southwark Culture, Health and Wellbeing Partnership. And this is a combination of health, statutory and voluntary organisations who are trying to work as a collective to really deal with the inequalities. So what we did as an org team, we worked with one of our local galleries, South London Gallery. We worked with our Latin American organisations, and we actually did a digital pop-up map for the Latin American communities. So any of them can go on the map, they press an organisation, and it lets them know what the organisation can actually do for them. This is a valuable resource because again, it's helping the Latin American community to know where can they find help. So literally just pressing it, it's digital, anyone can use it at any point in time, and that's how they can get access to information. What we also did is we also then shared with the community. So I said to the leaders, the faith leaders, the community leaders, what is going on? Why do you think there's a hesitancy amongst your communities? And they were able to give a valuable level of information and resource. And a big misconception behind hesitancy is the cultural differences. So there's cultural misunderstandings, people distrust the services for whatever reasons, historical issues of the past, generations aren't seeing any improvements, and all of these distrust issues are actually coming to the forefront. So I said to our organisations, how can we help break down some of this mistrust? The organisations help to put translations of the health information into Spanish, into Portuguese. They also then kind of came to a lot, we also did webinars. We also attended a lot of their webinars in local churches and local community groups. We actually went to them, our GPs went to these sessions to help share and break down some of the misconceptions. And again, all of this was then promoted right across all the boards of council, CCG, primary care, so all the organisations were working very much together. What this helped us to do was help to reach where we couldn't go. There's people that I can reach quite easily, but there's other people that I cannot because language is an issue. So with our pop-up clinics, we had them at various different days of the week. And we also had the organisations from the Latin American communities. They actually provided members of their staff that actually attended, one to translate, but also to then offer any further support for people that came. So we had several pop-up clinics, including at one of our local community food banks. And we had over 80% of those who attended, which is nearly 90 people attended. They were of the Latin American community, and they came from across northwest London, Croydon, Forest Gate. They came from all over London to attend, because throughout the Latin American networks, which we didn't understand completely, all the messages had been sent out, and they actually came and attended. People who didn't want to engage with their GP surgeries, weren't willing to share information, they came. So what this really helped us to understand is it's possible to reach the apparent unreachable. We just need to sometimes go to them. What this has allowed us to do is now break down some of that distrust and barriers. And now that we've engaged them in COVID hesitancy, we can now reach further, saying, right, what other issues do you have? Why are people not engaging with the health services? We can now have these conversations that were before very difficult. We've now opened up these doors. So what we really did was understand the local population, found out what matters to the people. We went to their organisations and asked them. We made information accessible. We found people that could help us to connect, but also to help them connect back with us. So that, again, not only the Latin American community, but we're also working with the African population as well, working with faith leaders and different community leaders, saying, how can we come to you? How can we best help your communities? So that is me in a nutshell. It's about being honest. It's about keeping the information consistent. I think that's the biggest issue, as Dr. Jagan John has said. It's the changing all the time, and this is what's causing that worry and concern. But I'm very realist. I'm a realist. I'm very much about being honest. I don't expect everyone to want to take the vaccination, but I really am comforted by knowing if I've given them all the information that's honest and true and accurate, and being that place and that person that can say, actually, let's talk about it. And if they take it, I've done my job. If they don't take it, but they've been given the true, accurate information, I've still done my job. But really, it's about working together as a whole collective to really get that message across. Thank you.
Thank you so much, Kate. Absolutely brilliant. And when we were talking about this the other day, I was just absolutely amazed about the amount of work that you guys have done, and also the outreach that you ended up having. It wasn't just in Southwark, it was in other areas across London, you know, bringing those communities into a place where they feel supported, and that they knew that they were going to be supported in the way that they wanted or needed. So thank you so much. Okay, we're going to go on to Farrah Ahmed next from Walthamstow West PCN, and also I think Cyber Salama. Is it going to be a double act or one of you? I'm not too sure. So who wants to?
I'm not sure. I think she might have had to leave.
No worries. Thank you so
So
much.
it's just me.
That lovely, perfect.
Yes, so my name's Cyber Salam. I job share with Farrah Ahmed for Walthamstow West PCN, which is in Waltham Forest. I'm also, both of us, she's chair and I am vice chair for Waltham Forest Women's Network, and both those roles marry very well. Like it bounces off each other, and we can reach the community. We have quite a large following with Waltham Forest Women's Network. So what we did initially, we both worked in the vaccination centre, and we started posting about it. First it was just posting about the public, you know, just like making it more personable. Then it was doing posts about vaccinators, the whole team, doing more posts like people that are well known in the community. So for example, there's Hibo Wadia, who's quite well known. She's an anti-FGM campaigner, and a lot of the people in Waltham Forest recognise her. So just making it positive, and just showing, you know, everyone is doing it, and just trying to motivate and persuade people in that way. We also had, for example, a lady who dressed in some amazing clothes. I think you can probably see in the picture there. She specifically dressed up for her vaccination, and then we shared that on our social media, and then we had other people commenting, oh yeah, that's a great idea, I'm going to do that. So it's just trying to give it that positive element, because people are weary, people are scared. So we were also fortunately enough to be approached by Waltham Forest Council to support the regular testing as well, which is really important as well. So then we produced a video of how easy it is. We also, on our social media has been the main thing. So for example, on our YouTube, we had our ex-chair actually say that Abu Amero is a virologist, and she produced a series of videos, and it was called like Real Talk with Say There, and it was just to quash all the myths and, you know, counteract all the scaremongering, if you like. And we've been really busy, I have to say. We've done a lot because of our voluntary role in Waltham Forest Women's Network. Another one in Waltham Forest is we both became Stay Safe champions. And that's basically joining the WhatsApp group, and they send you regular updates and information. So as the cohorts got younger and younger, we would share that to all our networks, you know, what times, which vaccine, first or second, you know, whatever, or if there were pop-up vaccine places. And also another one that I found was really helpful was, as we all know, mutual aid groups have been great with social prescribing and supporting everything, and been a great tool. So for example, on my road, I would just share all the stuff from the Stay Safe champion WhatsApp group, and that way you're sharing with people that maybe you don't have that much contact with. I've even shared it on my status where I'd say, oh, Pfizer or AstraZeneca vaccines at this time tomorrow, blah blah blah. And then I've had people message me, oh, can I do this, do I need to book, you know? So you're trying to engage people in every way you can. But I think the main thing is sharing via social media, Facebook groups, sharing to counteract all the misinformation. And oh gosh, we've just been so busy with the whole thing, and it's been a real positive experience, I'd say. Even on a one-to-one basis with patients, I think because you maintain like quite a trustful relationship with the patients, so they kind of take what you say, it has more weight. So if they have those doubts, and you do say, like, for example, the fact that 1 in 3 of us can be COVID positive and be asymptomatic is like, whoa. So that's like, you know what, I need to, you would never, a lot of people don't realize that. And once you find that out, it's kind of like, well, maybe I do need to get the vaccine. And also if they say, oh, does it hurt? And it's like, your personal experience of it. So, and I'm very honest. So for the first jab, my arm hurt a bit. The second one, I did get a bit of a fever, but it was gone in 2 days. So those kind of things, really, it's just sharing as much as possible and making it more personalized so that it doesn't feel like, oh, what is that? Raising awareness as much as you can. That's what we've been doing. And we've been very lucky with having the platform of Waltham Forest Women's Network.
Thank you so much. That was absolutely fantastic. And yeah, when I was chatting to Farrah the other day about the work that you've been doing, I was just like absolutely blown away by even just, the energy behind it. You really have made such huge use of your network and your roles and getting people together, but really bringing the community together to want to support as well. Yeah. And I think the fact that you've created your own content to kind of get out there as part of messaging has been really relatable as well. I think it's just been absolutely brilliant. So thank you so much.
Kerry, can I just say, just because it's tapping on to the end of the Waltham Forest.
Of course. Hi, Sharon.
Hi. Just a hot off the press example. I'm senior social prescriber in Waltham Forest and work very closely with Farrah, Cyber, Shamal also on the call today. And I was meeting up with a friend last night on Zoom. And she's a long-term friend, African Caribbean, in her 40s. And this is because all of you on the call who are social prescribers, we know we're passionate about social prescribers and we do it in our everyday life outside of work. So I did ask the question. I said, hi, so-and-so, have you had your jab? Not how are you, whatever. I just, have you had your jab? Really keen to, because I knew she was reluctant and I knew she was cautious and she hadn't. And so I took the conversation a bit more. And it was a simple thing in that she did not want the AstraZeneca. She was absolutely, no way, I'm not doing that. And in our borough, we have a free newspaper that goes out every couple of weeks. And the one this week had the Walthamstow Library that advertised when they were doing Pfizer and when they were doing AstraZeneca. She didn't get the newspaper. She's not on Instagram. She's not on Facebook. She's not on a lot of the social media that Cyber talked about. And as soon as I explained to her, you can go on Friday at the library for Pfizer, she says, I'm off, I'm going. So just having these little conversations with people any which way you can, and just providing other information to them about how they can access, I think would be great. And myself as a diabetic, I went for my diabetic review yesterday for my blood test. I'm sitting in a huge health center that does the blood test. Most of the people who are sitting there waiting, it's only about half a dozen of us. We are all Black and ethnic minority people, local residents, and there was a person helping you how to book in for your blood test. That would have been an ideal opportunity for them to ask us, have you had your vaccine or whatever? I thought, what a wasted opportunity. So if Dr. Jagan is still on there, anyway, where we have these sorts of places, where you're giving blood or whatever, and there are people who are sitting there, volunteers, helping people to log in, that could have been an ideal opportunity to ask people, have you had your vaccine? Do you have any questions, whatever? I really thought that was a good opportunity. Thank you, Kerry.
Thank you so much, Sharon. So lovely to see you and to hear that. Shamal, you've raised your hand. Did you want to say something?
Yeah, I thought I'd just chip in and just kind of echo Sharon and Cyber's words. I'm actually moving over to Walthamstow West PCN. I was in Leighton Collaborative before, but the reason I'm mentioning this is because the area that we are both based in, these PCNs, have wards with a large, predominantly South Asian community. And about 6 to 9 months ago, the vaccine uptake was very, very low in our most risk above 80, above 60-year-olds. And I think by going out and doing community service vaccines in like mosques and community centres really changed the narrative and really kind of encouraged people who would have a lot of hesitancy, would see things on WhatsApp. The family and friends were talking about, you know, there might be pork or gelatin in the vaccine, so don't take it. But actually bringing it into the community, into spaces that they recognise, with people and leaders who can talk about the vaccine and kind of promote it, has been really beneficial. And we've seen a stark uptake of the vaccine since. So it really does work when the community comes together. I think Farrah and Saiba, I'm kind of biased on this, but by going out into the community and handing out leaflets and speaking to people has been really, really powerful. So it's something that I just want to echo and say how well these areas have done because of that, and the community coming together and going into community spaces for the vaccine.
Thank you so much, Shamal. Always so great to hear from you. Thanks for sharing. Okay, next up we have Dr. Mohan Sekharan. So he's going to talk about from his side of things, from the personalised care teams working together. If you are there.
I'm here. Oh, there I am. Yeah.
Brilliant.
Sorry for attending late. I was sitting on the MS Teams for some reason, but great to be here and fascinating to listen to all the different examples. It's brilliant, and Gay in particular, I mean, is spot on. And in terms of how we reach out with our community to actually really support those who aren't so much hesitant but haven't got the confidence in order to make that decision. And so we're able to support them with lots of questions, and we need to meet them on their terms. So just want to tell you a bit about what I've been up to, and certainly how we've linked in with our community, and also use some of our ARS roles to support vaccine confidence. So I was approached by someone called Team Halo, and they're a UN-backed initiative, and they comprise of lots of doctors, epidemiologists, and scientists as well, all who have been got some information about the vaccine in order to share. And we've been trained up on TikTok. So I'm not, I wasn't on TikTok about 6 months ago, but I've got myself on it, and it's addictive. But it's a great way of reaching out to the younger crew, but there's also lots of age groups in there as well, about really showcasing, you know, what information is out there. And there's a lot of misinformation. It's fascinating, to the point where actually you actually start believing some of the misinformation yourself. So the team effectively go on there and they'll post around, you know, some of the facts, you know, AstraZeneca, Pfizer, what some of the side effects, the blood clot sort of area as well. And there've been over 100 million views across the world, actually. So it's a team across which is nationwide. So that's been really great. And as a result of that, I've used it for other ways of engaging and showcasing what our ARS roles do. So the health wellbeing coach, the social prescribing, and also the care coordinators. And it's been a great way to engage. So really, really powerful way of supporting people's questions and answers as well, and also being able to address them. Sharing data as well. There's a lot of misinformation out there, and actually we're not trying to force people to take the vaccine. We just want to make sure that they get the right information to them, so that they're able to make a choice based on the right facts. It's fascinating, again, how much misinformation is out there. And people are 50-50, and the anti-vaxxers prey on those people who are sort of 50-50 and don't want to take the vaccine. So it's important that we don't force people, but we give them the right facts. And as Gay was saying earlier, there's a massive amount of mistrust, and certainly from our community, who don't feel like they want to help the whole program because they feel like they've not been listened to in years. And so why now should they suddenly start taking the vaccine because they're told to do so? And I suppose that trust element has been missing. And even in the pandemic, that hasn't changed things. So we've really got to think about how we might be able to engage in this problem. As Gay said again, we need to go out and meet them, and some of the other programs as well working for us. Go out to meet them, go to the faith groups, go to church groups, and actually listen to what their concerns are, and actually say, look, these are some of the facts, these are some of the misinformation, and actually, you know, how else can we support you? We can only start building those links through this, and COVID has really helped us identify this massive mistrust issue. I think I've always known that it's been there, but not realised how big it is. And I think this also applies to other health conditions as well. So diabetes, asthma, COPD. You know, patients or people in the community don't engage with health, not because they don't care, but there's a lot of mistrust. And I think what social prescribing can do is open the door up to allow these conversations to start happening, and they are happening. And also the vaccine is the theme, to allow us to then really engage about a similar topic to get people on board. So I think it's a really exciting time to really get our community on board and answer their questions and be able to get their trust so that we can work on future things going forward. And social prescribing is a massive enabler to make this happen. We've not been able to do this in the past, and so that this has allowed us to do that. So a variety of ways of doing it, webinars. There's been a few webinars where there's been anti-vaxxers who've been on there and have been quite vocal, and it's been a shame, but they do exist, and we have been able to address their questions, and some of them had to be taken off because of being completely unruly. Linking into young people, so TikTok can certainly help with that, and also going to some of their webinars as well. So we have Youth Parliament here in Merton, and I was able to go along there to discuss any vaccine concerns, and again had some very interesting conversations, very, very different to what I've been used to from other age groups. And it's building those trusts so that we can support the resilience and any questions they may have. So I think there's a massive way to deliver this, and I think engaging on all our assets, not just social prescribers, but also health and wellbeing coaches and also GPs and our community for our current issue, which is the COVID vaccine. But now going forward, I think this opens the door to really exciting things going forward. So I kind of wanted to share that with you, and that's all I've got to say, Kerry. So I'm going to hand back to you. Thank you.
Brilliant. And I've just realised I should have probably put your Instagram tag on this slide so people can follow you and see all your fantastic TikTok videos, how you're engaging with the community and just sharing, information about your team and the kind of questions people can be coming to you and asking you.
Yeah, I'm a doc in Merton, so it's at Doc Merton.
Okay. Nice opportunity to plug, and we can pop it in the chat. We're going to make you a superstar. Thank you so much.
Cheers.
Jagan, do you want to jump in just before Anne? Is there anything you want to share in terms of what you've been doing with your team?
Yeah, I think, look at the fantastic work, Kerry, pretty much, I think very similar approaches across the system. I think the only thing I would add to this is about being flexible. That just because you did something one way and shortly afterwards we've had to change things around quite a bit in our system, where we've had, for example, in our vaccine centres, we have link workers there with us. So when they have the vaccine, for example, they then go and see a link worker to talk about their wider needs, because in some cases, because people have been obviously isolating themselves for so long, when they come to the vaccine centres, they do actually want to talk about a few other things that's troubling them. So I think the only thing that we have done in our teams is that if I look at the way that we've approached vaccine cautiousness across the system, is and what everyone has echoed is using those communities, using those faith groups, coming to them, webinars, using the whole personalised care team. But actually, one thing I will say is you've got to keep revisiting it and seeing if the approach works. And something we learned very early on, that what works for one group doesn't always work for another group, and the approach has to always be different. And I think what we've seen here is that how the plethora of different ways of reaching to not only support the information sharing, but also thinking about, how best to get to people so that they can understand things and also make informed decisions. And I think that's what that's what London's great about, is the fact that we are so different and we have different things we do, and I think as medical professional and also the PCN workforce and wider, we have to be just as flexible and be completely understanding. And I think that's the legacy of this work, that we've developed something that is so fantastic, which is about in-reach and community working, that after hopefully we get to a point where COVID is a distant memory, we can start applying for lots of other things going forward. And I think there's a real excitement for me that there is a little bit of a template here of how we just get to work with people on lots of things. And I think Mohan mentioned it as well. So hats off to all of you. It's really fantastic. But I think it's flexibility, adaptability, and listening. That's the key message.
Thank you so much. I agree. I think it does feel like a great foundational template, as you said, for approaching other areas that may feel, you know, tackling health inequalities and challenges, and really getting into the community and fully understanding how everybody works, you know. So we now have Anne Bowers coming on. She's the engagement lead for the Vaccine Peer Support Champions programme in Newham, but also it's wider spread now across London. So Anne, over to you.
Hi, hi everybody. I think should we just take those slides down, Carrie, so that we can all see each other? Fab. So my name's Anne Bowers. I'm the strategic communications lead for the public health team in Newham, and I also lead the London Community Champions program, which brings together coordinators from across all of the London boroughs who are leading champions programs. And Carrie and her colleague came and spoke to the coordinators on Tuesday, which was great, about how we might be able to better link up our different kind of resources, back to the point Mohan was making about using all of the resources and all of the kind of assets available to us. I wanted to just tell you a couple of things. One is that I'd be really interested to hear your experience of working with community champions, if any, or COVID champions, and what we could do differently or more to help improve that. And then the other is picking up on the discussion that was just had about social media and kind of misinformation. The Turing Institute, who are the world's leading institute on artificial intelligence, are based in London, based in the British Library, and they have just done some work on who is susceptible to misinformation and anti-vax information. And I was speaking to the researchers yesterday, and they're doing a next phase of research, and they're open to us helping to kind of influence the questions they ask in their survey. So we'll be hosting a lunchtime seminar next week with them to just sort of find out more about their research, and for them to listen to kind of different parts of the system about what we would find useful to understand from that kind of survey. And so I'll share the invitation with Carrie, as it might be of interest to some people, and I'll put their work in the chat so that you can see where they are so far. My kind of, I guess, take on it is it doesn't tell us anything we all probably didn't know, and really what we'd really like to know is, so how can we do things that are equally effective, if not more effective, in giving people the information they need in order to make the decision to have the vaccine. The London Community Champions program has been extended now for another 14 weeks, and that's really because two things have happened. One is that bringing people together from across different boroughs has allowed for practice to spread and ideas to be shared, much like you guys do in this forum. The other is that we've been able to provide insight and advice back to the senior leaders of NHS England London and Public Health England London around their policies. So for example, a few weeks ago when there was a big discussion about door knocking, to speak to people about the vaccine, there are very different experiences of the effectiveness of that. And we were able to gather sort of more nuanced understanding of door knocking and community outreach that helped inform what NHS England and what PHE London asked from local authorities and from CCGs. And most recently, we've been asked to views on second dose hesitancy and able to sort of inform the policy work there. So that's just what I wanted to share with you kind of in terms of our work, and would be really interested in any questions or thoughts about how champions and social prescribers, link workers, etc. can really work together.
Great, thank you, Anne. So I'm trying to find the mute button. So thank you so much. Does anybody have any questions for Anne around this before we do go into like the full Q&A session? But we do have another social prescribing link worker that would also like to share some work that they've been doing. So if you have any questions, maybe let's hear from Ikram. Do you mind if we hear from you first, and then we'll go to the Q&A session? Thank you so much.
Hi, my name is Ikram. I'm a social prescribing link worker for Brentford and Isleworth. So I'm based in the Hounslow Borough. So I got the job as a social prescriber back in December. So when I first started, I was straight away deployed into helping the vaccination. When I was doing it in January, I realized that the people that were coming in, we didn't have much people from, for example, the BAME background and the Muslim community. So what I did was I decided to have a meeting with my clinical leaders and the pharmacy leaders and discussing on how we could tackle this impossibility and seeing what we can do. And with that, I came up with creating a new outreach program where we were trying to get the uptake of the vaccines amongst the Muslim and BAME community. So what I did was I went to a mosque, which was right by where we were doing the vaccination, and had a discussion with the leaders there, suggested some of the plans, asked questions as to why they thought people weren't coming to get the vaccine. And from that, we got the understanding of that, for example, in the Muslim community, females felt quite reluctant in coming to vaccine centers because they didn't want to show their body. And from going to places, they didn't create an area where there was more privacy. So with that, when me and my clinical leader, we went there suggesting maybe how they felt about us coming in and doing it in the mosque. And the mosque leaders were really happy about that and said actually a lot of people would feel more comfortable if it was within where they came and had prayers there. And after the mosque leaders had a discussion with all of the attendees that come to that particular mosque. And we run a pilot on the 27th of March. And with that pilot, we only had 12 people to start with that came. And with that, I created a questionnaire asking people as to why they weren't getting the vaccine and what could be changed. And with that, a lot of the people was that there was the language barrier. So when they went in there, they weren't members of staff who could speak the language. So a lot of them didn't go because of that, and also because of culture sensitivity, lack of privacy in terms of religious beliefs. So with that, we went and did another, just spread the word, and we did another vaccine pilot. And with that, I managed to do over 200 vaccines amongst the mosques. And to spread the word, we also created a Twitter account where we got, with the consent of the patients, we took some pictures, spreaded it into Twitter. That created other mosques in getting in contact with me, asking how they could spread the word and getting people to come and get the vaccine. So with that, I also went to different PCNs and different vaccinations and had conversations with them in ways maybe they could have a more private room where people who had different religious needs could go to that room, and so that it made more people being able to come. So so I did that, and right now I'm in the midst of also doing a quantitative research with all the data that I've collected and the uptake of vaccine amongst the BAME and the Muslim community.
Absolutely brilliant. Thank you so much. And I know this was kind of a last minute jump on for you to share this with us. So I really appreciate that. And hopefully we can put that together in a case study as we have done with the other examples and have that ready. So thank you. Sounds like you've been doing amazing work. And also, the sense of pride and achievement you must feel from doing that too. I guess it must drive you even more to want to continue that momentum. So thank you so much. So to everybody, have you got any questions for people who have shared? I know we've got Anne and Minion have just had to drop off, but does anybody have any questions for Gay or David or Cyber or Shamal about the examples that they've shared today? Or any questions either for Dr. Jagan John and for Dr. Mohan Sekharan as well? there may be some questions you have on current situations or experiences with patients that you may find helpful to speak through them. If you want to pop anything in the chat, then that would be great.
Kerry, I've got a question if I can.
Yes, please go for it.
Sorry, I know I should be on the answering the questions, but I'm just curious to know from all of you as our community teams, what's your view on September when we have to do another vaccine? Do you think we will have just as much resistance, a booster vaccine, or do you feel that we might be slightly better off, the community might be a lot more trusting? So to all the panel members, do you feel that we might have an easier, I mean, the guidance has just come out literally today, literally about 20 minutes ago. And it talks about pretty much, it sounds like it's going to be in primary care or general practice by the looks of things. But do you feel that that we, as well as the concern that I have is the next 4 weeks, we're really pushing hard and all of you are really helping to support that. And some of the fantastic work is just, testament to all of that. But I just wondered is this something in the context of why I'm saying this is, do we just need to keep going with this community link because September's coming? I mean, what's your views?
Yeah, I'd like to answer that. I think personally, from what I've seen, Dr. John, I think the community, using the community assets is a really important thing. I understand and I appreciate how our GPs are and how rushed off they are at the moment with new systems and trying to get everything done. But we've seen a really good indication and pattern of certain services working in when they're done at a particular vaccination centre and then winding off and working somewhere else. So I think we really did well when we did when I mentioned things like community services, spaces like mosques, churches. And even things like at the moment we have a vaccine centre at the Walthamstow Library, but then we saw that there was a bit more uptake at the stadiums with younger people, and I think that's really important because there seems to be a push towards people not always wanting to go to community pharmacists or their GPs. So I think it would definitely be good to have a look at the data and see where people went, what kind of age groups, and kind of work with that to kind of build upon it. I think there would be, because we don't want to spend lots of time in the GP practices offering vaccines if people won't come, especially for a booster. So definitely I think community spaces are good.
Yeah, I was just going to say, I think to be fair, that's where social prescribing and a lot of the work we should be doing is in the community anyway. There's too much expectation that I must always go to my GP. That isn't always viable. And a real good way of maintaining in the long-term sustainability of the community is for us to go and actually back them up, because what they've got the evidence, we're referring to them, there's a bottleneck because of funding and other issues. But if we can then go to them, support them, we're talking about sustainability, we're talking about the community, we need to link together. So coming out of them, it'll just look like we've just used them and prove a point what they're trying to say. So see, you've just come for COVID, now you want nothing to do with us. And I've said before, it's about building that trust. And that trust is meaning what we say, don't change what we say, we don't just use them, we work with them, we support them with whatever they need. If we can, we support them, we bring the needs to them, we bring the team to them so they can see that we're not just talking the talk like other people, we're actually doing it and maintaining that continuity. That's where sustainability is really going to come from.
Yeah, a really good point, Gabe. Yeah, really good point. Do you want to? Oh, Mohan, yeah.
So I was just going to add, I think what my point is sort of carrying on from what Gay said. I mean, as we know, don't medicalise, socialise, and actually we're moving that model away from general practice. Actually, what are some of the needs outside that? And this would be a real test. Actually.
Mohan, I couldn't hear you very well, or is it just me? You were going in and out.
Oh, was I going in and out? Oh, sorry. So what I was saying, I think it's a good. Can you hear me now, or is that still not great?
It's better.
That's better, is it? No, I was saying, so September Club will be a good sort of tester in terms of how far we've gone, and actually we've built a lot of roads through COVID and through the vaccination program to see that measure of success. And actually, as Gay was saying again, is that we need to show what we've been doing is sustainable, not just when it suits us. and not when it's a sort of pandemic. We need to show that we can continue these links going well forward. So yeah, I completely echo that.
Yeah, I was gonna also say, I think it's really important as well. From my PCN, for example, now we've started to ease away from the vaccination, helping with that. However, I feel like in September, I feel like the social work link workers will be needed in terms of false information being spread about the September one coming up now. There's a lot in WhatsApp groups where people are saying, especially with the spreaded Pfizer risk of people having heart problems, now there's people who are spreading false information in that. So I feel like with that, it still has to be from the beginning in a way, in trying to say the reason why a booster is needed, because some people now have the impression and believe that because they have their 2 doses, they are fine and they don't need to come back. So it's just trying to tackle false information and give them more information into why they need the booster, and that why, like, for example, making them know that COVID is not going to go away, but what procedures we have in place in tackling them.
Yeah, 100% Ikra, and I think that's right. I mean, the myocarditis, which is that inflammation in young men that was being proven after a Pfizer. It's a bit like, I mean, it's a bit of a, I think, is it Cyber who said about, you know, just being honest, you might get a couple of muscle aches, you might get a bit of temperature, and you know, I think sometimes we kind of go the other extreme, saying it'll be perfectly fine. And I think Cyber said it right. And I think a lot of this evidence is like saying, well, we knew that, yeah, you know, we knew you got muscle pains, you know, after the thing, but now they've proven it, that there was a group of young men who did get muscle pain as well. But I think it's just being honest. I think you're right. And I think you're right. Keeping that dialogue up is really, really important to keep those roots. And I think, as Gay and Cyber said, and others, you know, it's about making sure we understand, and I think David as well, you know, their circumstances for why, what could get in the way, you know, that whole thing about childcare, or these are real issues, you know. we get really upset when people don't turn up for their vaccine, but we don't actually understand what their problems are. And that's London for you, you know. We're all hardworking people, we're all busy lives, and there's lots of issues going on, and sometimes it takes a bit of things. So yeah, I agree. I think the reason why I'm asking about this whole September thing is it's really important we get the message out across to say, look, we need to really support our link workers and our teams, you know, with their great community work. Don't let it stop, because that's the biggest issue. We've pushed so much, we've made all that inroads. My biggest fear at the moment is it's a bit of a stop and start campaign, and then you lose all that whole thing that you've done, that social media, all those things that you've done. And my worry is exactly that. So yeah, thank you for the feedback. It's really, really important, because it's just making sure that myself as clinical leaders like myself and Mohan, who are there for Southwest, it's making sure we keep a consistent message with you, all of you, to say this is what we all think. We can't lose that good work. We cannot go back in a way, and we do need to do a bit more of this in-reach stuff, because really it's more effective than people being pushed into a room in a general practice. We've got to think a little bit outside the box, and allow people. The other things that we do need to do is make sure we allow people the space to be creative, which I think sometimes we forget. The NHS is quite, you know, it's a certain narrow spot. If you don't fit through that door, it's just not going to happen. And I'm saying as well, actually, it doesn't always work there, because if we look at this campaign, the best work that we've done is actually when we haven't tried to do it in a certain way, and we've been flexible. But thank you everyone. That was my question, Kerry, sorry.
No, absolutely fantastic question, you know, and I should have put it to the panel to ask each other questions too, because, you know, you've both got things to share or to ask. I just wanted to say before we move on to the next thing that, you know, from the conversations that I've had with you, especially the link workers and the case studies that we've created, it's just fantastic to hear what you're doing. And And actually, so these case studies are available on our website, and it would be great to create more case studies. So in terms of people who may have other examples of things that they've done, you know, we totally will encourage you to get in touch with us and let us know what your work has been as well. So I've just created this slide. This is from the sign-ups. People kind of shared their suggestions in terms of potential approaches, and so I won't read through them all now, just to let you have a quick look. And I think quite a lot of them seem to be, you know, everyone's talking in a similar vein. So I think that's really encouraging to see and to hear. And also, if you've got any reflections from the conversations today, and if you don't feel that you want to jump on and say anything now or share anything now, you know, there will be an opportunity for you to do that, either via feedback or just send us an email. But yeah, if anyone does have anything, I'll give you a quick opportunity now to either jump on or just pop something in the chat. Otherwise, we can move on to resources and support that's available to you. Pause for a moment. No, let's move on. Okay, so yeah, so we've got resources available to you. I think this is what I wanted to say as well. To actually think back on the fact that, you know, several months ago we ran a session to say to you, you know, this is what's coming. This is, you know, we created this resource pack for you around vaccines and vaccine hesitancy. And then the kind of questions that you may be asked and the kind of responses that you may need to give. And then just from today, like the energy and the way everyone's just really gone for this and just done things to share what you have is just absolutely amazing. And I think everyone should just really take a huge amount of credit for the work you've done based on the resources we've had. But the resource pack that we created for you is recently been updated. So it does have the most latest information in there. The links are in this slide as well, so we will send you these slides. But basically within that, it's just a guide really to walk you through conversations. I know a lot of you are going to be very experienced with conversations now anyway, but it's just a handy thing to have if there's any kind of resources of links to information around different language groups, religious groups, things like that. You know, have a look through. It's a really useful resource for you to have to hand. We've also got case studies, as I've mentioned, so from the examples that have been shared today, and we'd love to create more. You know, we really want to continue to spread the message and the word of all the great work that link workers are doing, and personalised care teams as well. So there is so much going on, and I think there is always opportunity to learn from each other. Justina, I want to invite you on for a moment, if that's okay, just to mention a couple of the other resources that you have created and brought together. Bringing you in.
Thank you, Carrie. I think it's very important to mention the Future NHS collaboration platform. I hope that you are using this. There is a dedicated space related to COVID and vaccines within our Future NHS collaboration platform, and also you can use a database there to upload your case studies if you'd like to share them as well. I wanted to mention London Social Prescribing newsletters as well. Please make sure that you've added Liana's email to your safe list, so our newsletter doesn't land in your spam box, but please do check. And also you've got a link here to London Social Prescribing newsletter, so if you've missed any issue, you can always go back to the website and check what was there. So that's a little update from me.
Brilliant, thank you so much. And yeah, as well, on the collaboration platform, there is the COVID-19 Vaccine Equalities Connect and Exchange Hub. So that's open to everyone who may be working in this space, sharing all information, resources, opportunity to have shared discussions, lots of case studies on there as well. That it will be a workspace that you need to kind of register for to be able to get access to, but we'll share that information with you in the email that we send out to you all. There's something else that I wanted to mention. Oh, of course. So Public Health England are also working on creating some or delivering training around motivational interviewing specifically for the COVID-19 vaccine conversations. So as soon as we have that information, we'll be sharing that with you. There, as you know, are lots of opportunities and maybe and webinars as well for you to join on specific kind of topics, you know, to specific cohorts and vulnerable groups. So any of that information that we receive, we'll share with you, but equally, you know, encourage you to seek other opportunities as well if you have any questions. But we'll appreciate that you probably, you know, will be speaking with your personalised care teams and clinical directors and GPs anyway. Does anybody have any questions before we move to closing off? Does anyone else on the panel have anything they'd like to say? I know I've just mentioned the fact that, you know, it's just amazing to see and hear where you all are now in comparison to March when we first started kicking off these conversations. So yeah, absolute amazing work. So proud to be able to hear it and be part of it. So thank you. And you should be receiving an email from us that will be thanking you for joining today, but also including the link to a feedback form. So if there's anything you want to share from today's discussions and anything else that you would you want to know or would like to learn, please do add that in there. And also, as I keep saying, if you want to be sharing the examples that you have been then please do get in touch with us and send us an email. The email's just at the bottom there. So it's hlp.socialprescribing@nhs.net. Just want to say a huge thank you as well to everyone that's presented today and you know, spent time to be able to create the information resources. It's been absolutely invaluable, and we will be sharing this webinar online, so it will be popped onto YouTube, so you can watch it back or share with any of your colleagues that you feel would benefit from watching this back. So closing off the session in a moment, but if you have anything further that you want to say, anything you want to share, please do shout out now. Otherwise, have an absolutely fantastic rest of the day. Take this opportunity now to have a break and look after yourselves and keep doing all the fantastic work that you're doing. Take care.
Thank you.
Pleasure. Thank you so much. Take care, everybody.